Hello and welcome to today's special Gulf News webinar, Colorectal Health and Why It's Crucial for Your Wellbeing, brought to you by Faqih University Hospital. Now, despite general awareness on health issues and the importance of regular screenings, there is one area that not only gets very little attention, if at all, but often we're just too embarrassed to talk about it until serious symptoms show up. And that is colorectal health. The colon, however, is of course a major organ that is essential for waste removal from our bodies, and any issues with it will result in the body being unable to absorb essential nutrients or rid itself of waste. Most people will only start to pay attention to their colon health when they experience discomfort, but experts stress the importance of proactive screening and treatment to keep major colorectal health issues at bay. New research just released is also encouraging people to screen for colon cancer as if their life depended on it, because it just might. A major new US study has found that more and more young people are being diagnosed with late-stage colon cancer, prompting renewed calls amongst doctors for early detection and screening. It found that young patients aged 20 to 29 have had the highest increase in rates of new colon cancer cases diagnosed and are more likely to be in the distant stage of cancer when diagnosed, where the cancer has already spread. In the United States, the Preventative Services Task Force, the leading organization on preventative medicine, recently changed their screening guidelines for colon cancer from age 50 down to 45 after reviewing the recent trends of increasing cases of colon cancer in young people. So, what does that mean for you and your family's health? I'm Sally Musa, and I'm delighted to be joined by two leading experts from Faqih University Hospital, Dubai, as they give us a comprehensive overview of colorectal health. Dr. Amir Nisar is Consultant General Surgeon, and Reshma Devjani is Senior Clinical Dietitian at Faqih University Hospital, Dubai. We were hoping that Dr. Salti and Dr. Al-Hakam would be joining us as well, but unfortunately they both had emergency procedures to get to. Faqih University Hospital is built on an integrated healthcare model, bringing you the legacy of over 4 decades of compassionate care drawn from the renowned Faqih Care Group based in Saudi Arabia. It's also a world-class academic center committed to excellence through research, education, and clinical care. Located in Dubai Silicon Oasis, Faqih University Hospital is a 350-bed state-of-the-art facility providing primary, secondary, and tertiary care. It's equipped with cutting-edge technology and smart systems, so you know you're in very good hands. So welcome to all of you. Welcome to our esteemed experts. And before we start, just a reminder that if you do want to ask our panelists a question during the webinar, please do type it in for us in the questions tab on the screen. So welcome, Dr. Amir. If I can start with you. When we talk about colorectal health, this is such a broad area. And, quite frankly, it's something that no one wants to talk about. So help us take a look at the colon and the importance of colorectal health for our overall well-being.
Thank you for the invite, and a very pertinent question, because people are shy of talking about this or the problems that they face. And it is a very important organ of the body, as you rightly mentioned, because the diseases of the colon are very common, and these can be from colon itself or the rectum. But just to explain to our viewers first, that what does colorectal mean? So here's a mouth, and we eat through a mouth. It goes into the stomach through the food pipe. Then we have about 7 meters of small bowel. That is where most of the digestion happens with the enzymes, and we absorb all the nutrients that we've eaten from the food. About 90 liters of fluid and the residue from the food is presented to colon every day. and it includes the gastric juices, the juices which are produced from the saliva and in the intestine. And the colon and the rectum itself is about 1.5 meters long, and it's nicely curled up in the body. On the right side lies the appendix, and that's where the colon starts, where it's connected to the small bowel. It comes up under the right ribs, goes across the tummy, and then goes down on the left side. And the function of the colon is generally twofold. One is to absorb the fluid from here and then to store it and dry it up, because the 9 liters that is presented to the colon every day, only about 400 to 500 mils of fluid goes through the feces or when we go to the loo or the toilet. So this is an area which primarily stores the food, and at the same time, this is how we expel the food out. And this generally tends to get a fair bit of grunt over the time. Most of the time, our small bowel tends to give us less problems, but the colon can give us a fair few problems. And this can give us some symptoms which are completely benign and there is nothing to worry about. Or this can give us obvious problems as it happens towards the lower end of the back passage, as we call it the anal canal or the back passage, because that is the area which is sensitive. The rest of the colon is only sensitive to expansion or when it distends or blows. But this area at the lower end is very sensitive. And the commonest of the problems that we see in our patients are like hemorrhoids, which in local language is called bawasir, or fissure, which is a crack in the lining of the back passage. And the patients who come in, they do feel a bit embarrassed. But I think one of the things which does reassure them, we tell them that they'll be among probably 1 out of the 10 patients that we're going to see in a day's job who are suffering from chronic problems. So it's quite a common condition, and seeking help and advice is sensible.
I mean, it is really vital to be looking at that as well and paying attention to what's going on because, like you said, it could be a chronic problem. It could be something else. Talk to us a little bit about some of the more common problems affecting the colon and the rectum, because I know that they're split into functional and structural disorders. So what's the difference? What does that mean?
What happens that structure is like if you see a house, we have a house, what is the structure of the house? And if there has to be a door, there has to be a door. If there has to be a room, there has to be a room for that. And the function is how it functions, how the electricity is going through, how the water pipes are going through, which we cannot see, but are most important for work as well. Now, the structure of the bowel, as I mentioned before, is about 1.5 meters long. And about 1.25 meters is the colon, but the lower end is called the rectum. And then the lower 5 centimeters or 2 inches is called the anal canal. Now, the function of the most of the bowel, higher up, the colon itself, is to absorb fluid. And it produces some mucus, which is kind of a lubricant for the bowel, because when the feces dry up in the colon, it allows it to go through, and it allows it to propel through that. But in the rectum, it's stored, and it stays there. And the function of the rectum is not only to keep it there and store it, but also to provide us with some certain control, so that when we want to empty ourselves, we find a convenient time and a suitable place to empty ourselves. Now, when we look at the structure, there can be changes in structure, like sometimes there can be a growth in the colon, which we call as polyps. Polyps are like pinhead small size nodules, which can get bigger, and they can change into cancer as well. At the same time, in the structure, we can get changes because of the inflammation as well. And this is quite a common, there are common conditions like which are termed jointly as inflammatory bowel disease. Inflammation means that there is not infection, but reaction of the bowel, and it's a chronic condition. And ulcerative colitis and Crohn's disease, they come under these conditions as well, which can cause a change in the anatomy of the structure. Then other changes in the structure can come from some other conditions like diverticular disease, where we can get a stricture or a tightness in that area. But the fairly common problem is the cancer of the colon, which comes in about, is the 4th commonest cancer in the world, and it is prevalent in most of the countries and over here as well in Dubai and UAE. And we frequently see patients with this condition. And that is where the cells have started growing abnormally, and they have multiplied so much time that not only and they are growing in the colon, but they can spread out to the rest of the body. They can go to the lymph nodes, lymph glands, they can go to the liver, and the cells can disseminate to the lungs as well. So these are broadly the changes which one can get in the structure of the colon if something goes wrong. Now, when we come to the function side doesn't have any as devastating a change in the body or like a cancer, which could be life-threatening. But the function side is more common than the structural changes in the colon, because most of us can suffer from a bit of wind or gas in the abdomen, which we call as bloating as well. We can pass excessive wind, or we may get a bloating, which gives us discomfort. And as I discussed earlier, the colon is sensitive to stretch. So when it stretches, it can give us crampy pain. The other things about the colon is that how effective and how quickly or slow it works. Now, if we see that normally in most of the patients, they will go to the toilet once in a day and they will empty the bowel. In some patients, if they get constipation, they may go after a few days or may go after a week. At the same time, other people may get an intestinal hurry, in which cases they tend to go to the toilet 3, 4, or 5 times a day. Now, normally, if a patient is not suffering from any of the side effects of going to the toilet more frequently, then going to 2 to 3 times a day to going to once in a week will be considered as the wide range of the normal bowel movement spectrum. But if they're getting other symptoms with this as well, then this is of concern. The other thing about the function is that sometimes because of the inflammation, that the mucus or the lubricant which is produced in the bowel, if this is being produced in higher than normal because of the reaction, then one may pass mucus through the back passage as well, and one may get diarrhea with that. But one very interesting thing, which we will discuss in detail, is when we may not get lots of wind, we may not get lots of constipation or loose stools, but we may get crampy pain in the abdomen. And there can be lots of variable symptoms, which can run into tens of symptoms, which are bundled under one term, which is called irritable bowel syndrome. And most of the time, whenever we use the terminology syndrome, that means that it's a collection of a few things where we do not fully understand the condition, why it's happening and things, but there are multiple factors which are involved in that. And the easy way to explain irritable bowel syndrome is when our bowel is a bit sensitive to various things, sometimes to stress, sometimes when we are rushing, and our bowel reacts to it, and it gives us the crampy abdominal pain. So it's a bit more sensitive than that. And that can seriously interfere with patients' lifestyle, and they may require treatment or medication and consultation with the doctors.
And it could be caused by your diet. So, Reshma, if I can come to you, talk to us about the role that diet plays in colorectal health. It's quite a pivotal, important role, isn't it?
Hi, good afternoon, everyone. And yes, definitely diet has a major role to play on maintaining the integrity or the mucosa or the layers of the intestine. And some of the food, they act as a fuel to the cells of the intestine. Like, for example, if you eat more fibrous food, it helps in growing and maturation of the gut cells. So that's the reason why we encourage, our patients to go with, a diet, full of, whole grains and more of fiber, adding probiotics from yogurt and, kefir, for example. So yeah, it gives nourishment to the lining of the gut. That's why the diet plays a major role in maintaining the health of the gut.
Absolutely. You mentioned some of the foods there that are important for maintaining colorectal health. Can you go into a little bit more detail on that? In terms of the kind of ideal diet that we should really be thinking about in order to maintain a colorectal health.
All right. So first I talk about the negatives. So the negative, like, things like, refined grains, for example. If you're taking a lot of, let's say, alcohol, caffeine, or smoked foods, for example, like, smoked salmon, smoked turkey, and so on. The processed meats, for example, or char-grilled foods, for example, they add a negative impact. They produce some of the carcinogenic compounds when they are smoked. So when someone who indulges more into these kind of foods, they tend to get more prone to developing GI problems, or they have high risk of developing colon cancer. When it comes to the positive side of the diet, the best foods would be like whole grains, whole grain breads or, whole grain, like, for example, quinoa or barley and, burbil, for example, frike. So this is some of the food that will, add in more fiber. Besides this, it's better always to add fresh fruits and vegetables to add more fiber from salads. They add antioxidants also on the diet, and vitamins. Okay. And then avoiding alcohol. And adding probiotics, that's very important to add probiotics because it's very important to have a healthy environment inside the gut with the help of the good microbes, so that they do have a major role in developing, again, maturation of your, gut cells and, maintaining the health and the lining of the gut.
Yeah, gut health is super important here, isn't it? Can you just talk a little bit more about probiotics? And I think that confuses a lot of people, like what are probiotics and what would be a good type? Because I know that when you go to the pharmacy, there's a whole different variety of them, and it can be really confusing to know which ones would actually be good for my gut.
All right. So what does probiotic mean? So probiotics are bacteria that are healthy for the gut. You get it mainly from fermented foods. You get it mainly from dairy products, like mainly yogurt. You get it from kefir. People who are lactose intolerant may go with, over-the-counter supplements with probiotics. So, these are some of the sources that you can add. And for the bacteria to grow, you need to add prebiotics also. So prebiotic is the fiber that, the bacteria thrive on. So it's important to have a combination of fiber plus probiotic together to get a good amount of healthy microbes into your gut.
Okay, it's getting that combination right, isn't it? Dr. Amir, if I can come back to you, let's talk a little bit about risk factors and the signs and symptoms of some of the most common colorectal disease. You did talk a little bit about IBD earlier. If you can talk about that a little bit more.
Inflammatory bowel disease, which includes Crohn's disease, which mainly affects the small bowel, but it can affect the large bowel as well. It's a recurring condition in which the body reacts in a certain way. There are several theories about this, what may cause this. But eventually the patient ends up with inflammation and sometimes ulceration and even leakage from the bowel, and does require medical treatment for this, does require regular surveillance, and may require long-term therapies for this to keep it under control. Surgeries are at times required for Crohn's disease as well. Ulcerative colitis, to the contrary, is restricted to the large bowel, where the bowel gets inflamed, and one can get inflammation, one can get loose stool and diarrhea, one can get bleeding with the bowel movement as well. This can be limited just to the rectum, or it can be limited to the left side of the colon or to the whole of the colon. And sometimes, if the condition gets worse, one may require emergency operation. With both the conditions, the risk of cancer in the bowel increases as well. So one does need regular surveillance endoscopies as well. And these are the conditions which is managed by our gastroenterology colleagues, who not only see the patients, provide them with the appropriate medication, but monitor their progress as well and perform the endoscopy, which is in the form of a telescopic examination of the bowel that they do regularly, take some biopsies and keep an eye on it. And if any changes are noted, then of course surgery will be recommended, and they will liaise with the surgeon and consider the surgical option for the patients.
Very important to keep in mind, because it's amazing how many people I know who will complain about what's going on, with their stomach, with their tummies, and it's definitely something that we need to make sure that we do get checked out if there are any symptoms, or if there are any discomforts there as well. I'm just going to remind our audience that if you do want to ask the panelists a question, whether you want to ask Dr. Amir or Reshma a question here, you can do that. Just click on the questions tab, type your questions in, and we'll get to those. We also have polls running today. So we would love for you to be part of that as well, so that we can see where everyone's at with their knowledge around the topic and their views around what we're talking about here as well. So click on polls, cast your vote, and here is the first poll question. So When should you start colorectal screening? Is it when you're 40 years old and above? Is it when you're 45 years old and above, or when you're 50 and above? So get your answers to our live polls in. I can see our polls are coming in right now as we speak. It's just jumping around. We're going to come back to that. We're going to come back to the result in just a second. And I'm going to ask you, Dr. Amir. Now, usually when you turn 50, you get a birthday present from the doctor, which is a colonoscopy. But recent guidelines around this, they're being revised, suggesting that we should actually be having one at age 45 or younger. So how important is early screening? At what age should it actually be?
I agree with the new guidelines because initially about 20 years back when we started colorectal screening in UK and Europe and other countries, the age was 6 years of age. But at the same time, this is for general population. But if we have people in public who have family history of bowel cancer, and again, we look at it, if this was their first blood relative, one of their parents or uncles and aunts, and at the same time, we also look at what age they were diagnosed to have the cancer. If they were diagnosed to have the cancer at a younger age, like 45, 50, or 55 years of age, then the time of the screening has to be brought forward. But this has come down to 55, 50, and now 45 is being recommended. If one is having any symptoms, or even at a young age, even if one does not have very definitive symptoms of chronic cancer, but having significant large bowel symptoms, as you very rightly said, that it interferes with their lifestyles, ideally they should see the doctor and they should consider having investigation done on the bowel in the form of a telescopic examination of the large bowel, which is called a colonoscopy. And during this examination, we not only look at the large bowel, but also the small bowel as well, as it joins the large bowel. And that excludes any inflammation or any issues with the small bowel or Crohn's disease in that area. Now, the diagnosis of irritable bowel syndrome should be by exclusion. And they were meaning, I'll just emphasize on that anyone who is having slightly different symptoms which they did not have before, it's best not to label this as irritable bowel. Because let's say if I had a problem with my hand and I have some scratch on the hand and I have pain, I'll have a look at it. And that's the right way to do it before I make up my mind what has gone wrong with my hand. The same way is with the bowel as well. Though this is hidden from us, but not from all of us. And we can do an examination, if a telescopic examination, and we can have a look inside as well. So rather than labeling a condition as irritable bowel syndrome or, it's just a constipation or just a change in the bowel habit for a short time, ideally at any age, one should have the test done. Now, coming to the subject of the screening, if one was completely asymptomatic, then the age of 45 or 50 is sensible. And in screening, one doesn't have to just get a colonoscopy done. And there is another test which is available, because most of the time, if we have a polyp and if it's getting any bigger, we can lose a little bit of blood from that. And that comes out in the feces when we pass our stools. And that can be tested with a very simple stool test, which is called fecal occult blood test. And this is a test which is offered to all the individuals. If the test is negative, then one does not have to proceed with a colonoscopic examination. But if the test was positive, then of course one needs to have a colonoscopy done. There are other options available as well, which are not very widely or readily available. But in Fakir University Hospital, we do offer that, and that is a radiological assessment of the large bowel as well. So though the colonoscopy is the gold standard, and by looking at the large bowel, we have the flexibility of taking the biopsy or removing the small polyps as well. But at the same time, we can do a double contrast CT scan, barium enema as well, which our radiologists are very good at doing, and we have state-of-the-art facilities for this, where contrast is passed through the back passage after appropriate bowel preparation. A CT scan is done, and then this is put in a certain program, and it gives us a 3-dimensional views of the whole of the colon, and it gives us very realistic images, and we can pick up if there is any issue there or not. However, when the colonoscopy is done, this is done with bowel preparation, and patient is given appropriate sedation so that their completely unaware of the test as it is being done, so that they will not have any negative experience. And having that test done probably once off will be helpful. Then probably after 5 years, one can have further fecal and gall blood tests if nothing was found in the first instance.
That's really good to know, and it's important to think about that. On our poll, in fact, it's kind of almost pretty evenly split. We've got 33% of people saying 40 years and above, 42%, the highest percentage saying when you're 45, in fact, 45 and above, and 50 and above, we've got 25% of people giving that answer as well. So as you say, Dr. Amira, it's a good idea to start from the age of 45 and make sure that you are getting screened and getting that taken a look at, because it's like you said, it's something that we don't see, but there are very simple tests that can be done to see if anything needs attention there. Reshma, if I can come back to you and ask you, we often come across family and friends who complain about bloating. I feel bloated, and sometimes after certain foods that we eat, we feel bloated. So talk to us a little bit about that. What kind of foods can cause bloating? What will help, in fact, as well?
All right, I come across so many patients who have this complaint of bloating, and when I assess the lifestyle, I mean, yes, if you are having late evening meals or eating big meals, eating a lot of fiber. Sometimes I come across patients who would tell me, I'm eating a very healthy diet, I'm eating a lot of fiber into my food. So a lot of fiber, actually, what happens is the microbes in your gut, they ferment the fiber and they cause you, they result in a lot of gas formation, and which is why you end up having bloating. Besides this, if you are intolerant to lactose, fructose, there might be other causes of having, bloating. It could be having a lot of fizzy drinks. If you are, indulging into sparkling water often. So these are some of the other factors that might, be the cause of bloating. So these are very common causes that I come across with my patients, and yes, they can be rectified with your lifestyle for sure.
So what would you say would be something that would help that as well?
Okay, so of course, having small frequent meals, if you have this problem, avoid large meals, have small and frequent meals. Of course, have natural, like still water, not the aerated drinks or sparkling water. And then there's also one of the diets that we call low food map diet. Low food map means a lower content of fermentable carbohydrate into your diet. There are some groups of vegetables and fruits. They are high on fructose content, and they might result in fermentation. They are, and might cause gases. So we also ask the patient to do a food diary. In this case, it happens actually also very commonly with irritable bowel syndrome. So patients usually complain they come with the complaints of bloating and gases and, discomfort because of the gases. So it's better to always have a diary and to see what foods suit them and what, foods they need to be avoiding. If they feel they get similar symptoms eating the same food many times, they have tried. So that is the reason that, they need to avoid those foods. Or we might put the patient on an elimination diet where they avoid these food map groups or the fermentable carbohydrates.
Exactly. I think that's just incredibly important because, of course, for each one of us, it's going to be different, isn't it, Reshma, in terms of, what foods are going to be something that we're comfortable with, what foods we're not comfortable with, and to really pay attention to the body.
There is no one diet fits all. So it's individualized. It's highly individualized.
Yeah. And that's really important. I love what you just said about making sure, you track what it is that you're eating and how you're feeling after that, and to really, truly, listen to your body. It really is vital as well. Dr. Amira, let's come back to colorectal cancer. New research is showing that there's an alarming increase in colorectal cancer in the age group of 20 to 29. It just seems so incredibly young, and you wouldn't think that age group would be subject to that particular cancer. So what might be causing the increase in that particular age group? And indeed, what is it that causes colon cancer in the first place?
There can be, I think it's a very important question and it concerns us all, the cause of the colon cancer. In majority of the cases, the colon cancer can be due to changes in our genes, which can cause the cancer, where the cells start dividing more than they should and they get out of control. And there are several conditions in that, like HNPCC, which is hereditary non-polyp colon cancer. Then the other is FAP, which is familial adenomatous polyposis. In these two conditions, what happens that in HNPCC, there can be polyps in the bowel which change into cancer, and this is because of a genetic reason. In FAP, there can be hundreds to thousands of polyps in the colon. And not only they are restricted to the colon, they can be in small bowel and duodenum as well, which can change into cancer. And these are familial conditions. Then the family history of chronic cancer. And there are some other syndromes and conditions like Peace-Jagger syndrome, where one can get increased risk of cancer. Now, these are the conditions where one is more predisposed to getting cancer. However, in general public as well, there are other factors which influence us as well. One is age. And as we discussed, age over the 50, that was a common scenario. One would be at a slightly increased risk of getting cancer or changes in the bowel, forming some polyps in the bowel. Not everyone will form it, but a certain percentage of people will have it. Then smoking has shown to increase the risk. Drinking alcohol, and even in moderation, increases the risk as well. Increased weight or obesity is another issue as well, which can cause cancer. Again, lack of exercise, eating red meat, and then there are certain races and certain communities in which the risk of the cancer is higher than the others. So we are familiar with all these conditions and we know what it is. Overall, the risk of the chronic cancer with the better surveillance and getting rid of the polyps in the developed world before it turns into cancer is reducing. So we have been marginally successful in that. It hasn't come down as much as it should. Still, about nearly 1 million deaths in the world are from colon cancer every year. So we haven't come down on that and we haven't controlled it as well, but we have improved in that. But the concern of this cancer, in a way, to the pertinent part of your question, in younger age group, that the shift that we are seeing, that's very worrying. Because since 1994, we have seen that about 2 to 3% rise in the colon cancer every year in the younger age group. And some people who are as young as 30 to 40 years of age can develop this cancer. So not only it's a young age group, but for one reason or another, this cancer tends to be very aggressive as well. And lots of time, it's difficult to get a control of this or get a cure from this cancer in younger age group. So we should not take any symptoms of bleeding from the back passage or any other change in bowel habit or anything lightly in this age group. We should not wait for one to have screening. So screening and diagnostic endoscopies go hand in hand. So anyone who is completely normal and does not have any issues, does not have any problem with the bowels, yes, we should start their screening at the age of 45 and go onwards. But anyone who is having symptoms, and the worrying symptoms about the cancer are when we get a change in a bowel habit, we lose some weight, we get excessive bloating of your tummy, or we are passing blood in the motions. Then I think it's best to contact a doctor and get checked. Lots of this bleeding will be simply from the hemorrhoids, and that is very simple, nothing to worry about, can easily be managed with conservative measures. But if there was a risk or if there were any signs of or risks of cancer, then the doctor can identify that and he can monitor it and he can progress it to further diagnostics and appropriate treatment. Now, again, in the cancer in the young age group, 50% of these cancers are from the two conditions, which is HNPCC and also from FAP, where the polyps are formed is familial and it's a genetic issue. And from there, it can be picked up and one can have a regular surveillance because this familial adenomatous polyposis can start at the age of 9 or 10 years of age. There are lots of polyps there. It's regularly monitored. And of course, one may require surgery by the time they're 30 or 40 to remove the whole of the bowel anyhow to prevent the risk of cancer because the risk of cancer is very high. But this, knowing the enemy in 50% of the cases doesn't make it easy for us because all the scientific fraternity up till now, they don't understand why the other cancers are happening in the young age group. And that is what the worry is, that it is on the increase, but still half of these patients who are having cancer, we don't know the reason for that. And whether this is one of the causes, our eating pattern, our diet, processed food, eating more red meat, drinking wine and all those things, if those are the causative factors, then why in such a short span? And I think that's where the jury is out, and still the work is out. But I think the take-home message is that one should not take this condition lightly. If there is any bleeding or any issues, one should consult one's doctor, a family physician, a gastroenterologist, or a surgeon to see them and discuss the issue. And the other thing about this is that one should seek appropriate treatment as well, and one should not be shy about it. Lots of time, like in breast cancer, before the awareness was increased, women were too shy to approach a doctor and get seen by them. But as awareness is increased, not only they do self-examination, they do self-vigilance as well, and they seek medical advice at the earliest. And that's the take-home message for the chronic cancer as well, and colorectal cancer. If there are any issues, don't be shy, get it checked. There are lots of people who are getting it checked, and this is lifesaver, and this is really important for us.
Absolutely. Like you said, sometimes we're just a bit too embarrassed to go and get it taken a look at, or we're afraid of what we're going to find. People don't want to hear the word cancer and that kind of stuff. But honestly, as we always say, and as we know, the earlier you go, the easier it is to take care of any of these things. And so it brings us, in fact, to the next poll question. Are you comfortable with the idea of a colonoscopy or a colon-related screening procedure? Is this something that you'd be totally fine going to get today, tomorrow, if you needed to? As Dr. Amir said, some people are a bit embarrassed about it. Some people are not comfortable with it. Where do you fit in? Are you a yes, I'm comfortable with it, or a no, I'm not comfortable with it? Do let us know on our live polls. That's the second question that we are uploading right now onto the site. So if I can ask you, Dr. Amir, about hemorrhoids, we have mentioned them a little bit as well. It's quite common, obviously, but can you avoid hemorrhoids? Can they be avoided?
A very important question, I think, and this is one of the commonest problems, the hemorrhoids. Now, first of all, we need to know what hemorrhoids are, because we are generally very embarrassed about even talking about hemorrhoids. Now, hemorrhoids are nothing but like veins that we have at the back of the hand or in our feet. These are more prominent in our feet than in our hand because of the gravity, and as we stand on our two legs, the force of the gravity is highest in the feet, and our veins in the feet are more prominent. The same thing is about these veins as well. And normally there are three veins, but sometimes they can be secondary veins as well. And these veins become prominent with age. And in colorectal surgery, we say that everyone over the age of 30 has hemorrhoids. Whether they have a problem with this or not is a different matter. Now, this may be an overgeneralization, and I think in England we would say to our patients, but sometimes we see patients with 45, 50, 60 years of age, and they may not have any prominent veins or anything. But 30 is about the age when we start having issues with the hemorrhoids. This is one of the commonest things. And while we were talking about the screening or the more scary aspect of the large bowel diseases, most of the people, when they will come to the hospital or get it assessed, they may have minor hemorrhoids which are giving the symptoms. And once these are spotted, they'll be done, and they will not need any further treatment or may not require a colonoscopy. And as we normally say, fear for the worst, but hope for the best. So don't be worried if you're coming to the hospital. Do not be scared that it's going to be a cancer if you're bleeding through your back passage. It is commonly a problem with the hemorrhoids. Now, what causes exacerbation of the hemorrhoids? And mostly this is either our stools are too hard or too loose. So if you're having hard stool constipation via straining, that increases the pressure. And it's just like when I go to get a blood sample taken, the nurse or the doctor will put a tourniquet on my arm and the veins in my hand will swell up. Once the tourniquet is removed, the veins drop. So with the constipation, when we are straining, this is the exact situation which occurs because we have two muscles guarding the back passage, the internal sphincter and the external sphincter. Now, the internal sphincter is what our brain controls without us knowing. The external sphincter is what we control. So when we are asleep, talking, walking around or doing anything, playing sports, this is the internal sphincter which controls it and keeps us continent so that we cannot pass any wind or we cannot pass any feces involuntarily. The external sphincter is, let's say if we were in a mall and we needed to go to the toilet and we had to rush, then this is external sphincters through which we can hold ourselves. These two sphincters should stay relaxed. If they go into spasm or get tight, that's when the pressure increases in the back passage and the hemorrhoids get worse. They can go into spasm if we were constipated, as I mentioned before. They can go into spasm if we were straining and we were having lots of diarrhea. But they can also go into spasm if we had a crack in the lining of the back passage, which is called anal fissure. And the spasm makes the hemorrhoids worse. So as Dr. Reshma mentioned earlier, that eating high fiber diet and eating proper food, I think that's the most important thing. But one of the other very important thing for the hemorrhoids, which I tell all my patients about, is that they should lose their library. Now, this is what I used to say in old days. And nowadays I say to my patients that they should lose their WhatsApp group in the toilet and replace that with an egg timer. Now, that's very important to understand, because when we go to the commode and we sit on the commode and we either read a magazine or a newspaper or something, the library that we build up in our toilet because it's a relaxing time, or nowadays when we go into a WhatsApp group, the time can fly by. And the issue with that is that if we take more than 3 minutes, then this is causing congestion of the hemorrhoids. And this can cause anal spasm as well, and that causes a problem. So I tell them that replace that with an egg timer. So 3 minutes, you're in and out. And that demands another thing as well, that we should not go to the toilet as first thing in the morning as a habit. Rather, we should just go there when we have to go there and we can't wait. And I think that makes the difference. So once we discipline ourselves, we can avoid having problems with the hemorrhoids well into our 30s, 40s, 50s, and 60s. And if we already had hemorrhoids and if we had the treatment, still we will need to follow this discipline so that new hemorrhoids or new veins will not become prominent. So hemorrhoids is a minor issue. And I believe that in UAE and Dubai that I've been, these get overtreated over here. Sometimes very young patients in their 20s and 30s are advised to have surgery. Sometimes we are doing their stapled hemorrhoidectomies and other things, which is an overkill. And that can cause long-term problems as well. So ideally, the hemorrhoid issues should be dealt with conservative measures, with proper diet, with exercise, to walk around, getting up in the morning and drinking some water or something, because that initiates a reflux in the body. This is called gastrocolic reflux, where if anything goes into the stomach, the colon starts moving. So it likes to empty itself. And we all notice this. This happens once in a day in the morning. So having a glass of water or a glass of a drink or something, that helps as well. Exercise makes a difference as well, because that promotes our gut activity, relaxes us as well, and allows us to empty our bowel at the regular times. So hemorrhoids should be taken seriously. If left alone for a long time, then one requires major surgery. But most of the hemorrhoids are easily dealt with in the clinic. And they do not require any extensive surgery or not even a general anesthetic to deal with those.
I think you've just given us one of the lines of the entire webinar. Leave your library outside of the bathroom and leave your WhatsApp groups outside. It should be an egg timer, 3 minutes in and out. I think that's just a major guideline right there, isn't it? So in and out, everybody. Leave the phone, don't take it in. If only go when you need to go. I love it. Really excellent advice right there. Let's take a look at our second poll. Where are we up to? 78% are saying that they are comfortable with a colonoscopy and other screening procedures, which is really good news. That's excellent. And we do have questions coming in. We are about to launch into your live questions to our panelists in just a moment. Reshma, I know you've talked about fiber and healthy foods earlier. If you have any specific recommendations around healthy fiber, we hear about it all the time. Fiber is key to good gut health. Any particular sources? I know that you've mentioned some before, talking about legumes and certain grains and that kind of thing.
All right. So as we all know, excess of anything is bad. So there's a limitation that you should follow when it comes to fiber. So the recommendation for females is like up to 28 grams maximum over the day. For males is 35 grams maximum over the day. Or if a person is on a specific, let's say, diet, like usually we calculate as 14 grams per 1,000 calories. So for example, if you are on a 2,000 calorie diet, your recommendation would be 28 grams of fiber per day. So that's where you should be able to count. And, and I'm going to give you now the fiber content of commonly eaten foods. So for example, if you're eating like bran cereals, they would give you around 3 to 4 grams of fiber per serving. If you're eating legumes, let's say half cup, it will give you almost 3 to 4 grams of fiber per serving. If you're eating bread or other grains which are not really high on fiber, you get 1 to 2 grams max per serving. If you're having a fruit, maximum 2 to 3 grams of fiber per serving, or a vegetable, maximum 2 to 3 grams of fiber per serving. So you need to count the number of servings of these foods that you've had over the day in order to be able to count how much grams of fiber you've eaten over the day. So that's where it'll help you to calculate what you've eaten and how much fiber you've taken over the day.
Really, really good tips there. I love that, because sometimes we think a food has got lots of fiber in it when actually it has very little, if at all, as you just highlighted there as well. And to be careful about the sugar content, because sometimes it can be high in fiber, but also high in sugar, especially when we were talking about cereals. But Dr. Amir, let's come back to you before we start talking about the questions and taking the questions there. Treatment and diagnosis, they've evolved a lot over the last few years when it comes, to colorectal health. What are some of the advanced technologies, in fact, for diagnosis and minimally invasive treatments that can help the patient recover in a more efficient and more comfortable way?
Yes, I think technology has come a long way. And over the last 30 years, we have seen a great improvement in the overall care of the patients, in how we diagnose them and how we treat them. So from diagnostic point of view, our new generation scopes, those are excellent, which give us very good and accurate diagnosis. New artificial intelligence has come in the scopes as well, which while we are screening and we are doing the colonoscopies that pick up any minor lesion which might have escaped our eyes, our diagnostic facilities are excellent. At the same time, we still depend on the conventional diagnostics like barium enema sometimes, though less nowadays. But the new CT scan guided colonoscopies which have come in which we do a CT scan and we do not pass a telescope through the back passage. We can look at the whole of the colon as we are looking at it. So I think these are great advancements as far as the diagnostics are concerned. As far as the surgery is concerned, that has come a long way. And I think laparoscopic surgery started about 30 years back. And laparoscopic means, lapro means camera, and abdomen, and scope means the camera or the visibility. So we use fine cameras now to look at inside the abdomen, and very fine portals through which we can place in fine instruments and perform the surgery. That has really improved and changed how we deal with the cancer. And as I discussed earlier, the large bowel is about 1.5 meters long, going all the way from right side on the top and to the left side in the abdomen and down into the pelvis. So it's a very wide area to cover. So in traditional days, we used to make big cuts in the abdomen to do the surgery. Now we can do this with very fine cuts in the abdomen. So laparoscopic surgery is there. And an additional thing which has come up in the recovery, and that has primarily come through from Sweden, then to United Kingdom, and now almost in all the developed countries, that is the enhanced recovery program. In old days, we used to give the bowel preparation to the patient, bring them into the hospital before surgery, and then keep them in for a week or so. Nowadays, most of these operations can be done between 1 to 3 nights of stay in the hospital after surgery. So though we are performing a major surgery, but there is certain protocol in which we treat them by giving them high protein drinks, mobilizing them early, not using catheters. And our anesthetic friends really come into their own because of the pain control, how they do it, the anesthesia they provide to the patient. So it's a huge team effort with the dietitian, with the gastroenterologist, with the radiologist, with the anesthetist, the intensive care, and the ward staff. We all join hands together. And I compare my patient to like a Formula One driver. So I tell my patients that they're like Formula One driver, and all of us like the crew in the pit, their team. And we are all there to look after them. And like sometimes you must have noted that when a beautiful car comes to the pit, in a fraction of a second, They change all the four wheels and the car is back on the track. So this is more or less like that. So I see myself as one of those 20 people looking after the patients. So surgery is not the most important thing. Anesthesia is as important or more important. Gastroenterology, the diagnosis is as important as well, and especially the nursing care afterwards. And I'm very pleased that in Faqih University Hospital, we have a great selection of the team across the board. And we have fantastic nursing teams in the wards. We have good dietitian, we have good physiotherapists who mobilize the patient early. And of course, our gastroenterologists and the surgeons. There are three of us surgeons, Dr. Nadir Salti, Dr. Isam, and myself. And we are all there. We all join hands together and deal with the complex cases as well. And I think it's a very good team effort. And the whole hospital environment is very nicely structured and built towards this to provide safe care to these patients and to improve their and enhance their recovery with the most latest of the technology and the treatment options.
I love that analogy of being like a Formula One driver, and then you've got your team all around you to get you back on track and out there as soon as possible and as comfortably as possible. It's just brilliant. Let's jump into our last poll question just before we start taking the audience questions as well. So, question number 3 for the poll: when was the last time you received a colorectal screening? Was it less than a year ago? Was it more than 1 year ago? Or maybe you've never had one. Get your votes in now into the polls, and let's dive into our audience questions. Now, we have one here from Siram asking, does heredity play a role in colon cancer? And if one of my parents have colon cancer, am I at an increased risk? Should I be screening more often? I think you touched on that earlier, Doctor, if you want to clarify that.
Yes, if one of our parents had colon cancer and if they were below the age of 60 or 65, I think we should start having screening fairly early on in life. So, and yourself and your siblings should have the screening, and you should have a colonoscopy as well. So screening is not only just doing the fecal occult blood test, you should have regular surveillance endoscopies as well. When we do the endoscopy, there is a possibility that your colon may be entirely clear. Then we decide that the duration of the next colonoscopy will be after a longer period of time. However, if you find a very small polyp, because a very small polyp, it's a pinhead size, and in order to grow into cancer, it takes about a year or two to grow into cancer, depending on what type of cancer it is, if it is aggressive or slow growing. But it takes this much long time. But once we remove a polyp, then we may do a follow-up colonoscopy within a year and a half or 2 years, depending on the type of polyp that we have. And once we clear the colon of all the visible polyps, then we go on to 5-year colonoscopy. And I think the risk stratifying is very important. And for that, you need to see your gastroenterologist or you need to see your surgeon so that they can sit down and discuss with you and decide on your screening program.
Mm. Very good. Very important there, that particular information. This one is from Harsh. He is asking, I heard Dr. Amira say earlier that it's normal to have bowel movements 3 to 4 times a day to once a week. But if your pattern of bowel movements changes suddenly, should you worry? Should I take it as a sign and change my lifestyle? Is it 3 to 4 times a day to have a bowel movement? How many times a day did we say it was, Dr. Amir?
Yes, I think she's absolutely right. She heard me right. Because what I was saying was that normally we move a bowel once a day. Some people would do it twice a day. But I mentioned there's the normal range of bowel movement that we consider as normal. Where after speaking to the patient, after analyzing everything and assessing them, we can call as normal is having 4 to 5, 6 bowel movements a day, up to 1 bowel movement a week, or some people will have 1 normal bowel movement every 2 weeks as well. But then, if we have a sluggish bowel movement and we are getting lots of abdominal cramp and pain and problems, then it's an issue. Then it's not normal. It is affecting our lifestyle, and then that is what needs to be treated. At the same time, if we are having 5 or 6 new stools a day and we are having problems and symptoms with that, then that needs to be corrected and they need to be treated as well. But the question over here is pertinent because the lady has mentioned that if she had a normal bowel pattern and suddenly her bowel pattern has changed. Now that is of concern because when bowel pattern changes, unless we have eaten anything different and it changes for a short period of time, for a few days to a week. But if the change of the bowel pattern has gone on our normal diet that we were eating before over a period of 2 or 3 weeks, then one should consult one's doctor to get it checked. Because either there is an infection or ongoing infection which is causing the problem, or there might be a change in the structure of the bowel, as we were discussing before. So one has to exclude the possibility of bowel cancer or some other growth which might be causing the problem. So then it's best to get it checked. Just dietary adjustments or taking some medicine off the shelf would not be recommended if it has gone on for more than a few weeks.
Next, we have another question here. This one is from Neha asking, of late my baby doesn't have regular bowel movements despite no drastic change in her food pattern. Is there a reason to be worried there?
No need to worry to get worried about it. We all have babies and they go through their growth pattern and their body adjusts accordingly. So no need to worry. There's no risk of anything serious there. It's just their function that is going on. And especially when babies have altered bowel pattern and if they get constipated, sometimes it makes it difficult for them to open their bowels and they are scared of it because it can hurt them. And sometimes when we are opening the bowel, and if the stool is very hard, it can cause a tiny cut in the lining of the back passage, which we call as anal fissure. That can further scare them as well. So I think it's very appropriate to give them plenty of fluid so that they're drinking enough fluid, giving them juices and higher of its diet, or some fresh fruit and vegetables if they have already been weaned. That'll help. Sometimes if the formula milk is too concentrated, then of course we may consider diluting it a bit and giving them some extra water depending on what age they are. But it's no concern. As long as the baby is fine, they're opening their bowels every 2-3 days, and they're not having pain, I would not be worried.
I would like to add something here. Sometimes patients are taking, like babies especially, they're taking a lot of cow's milk, like more than 500 ml over the day. Of course, sometimes the cow milk can be constipating as well, other than the formulas. So yeah, if the child is having a lot of cow milk, then it should be reduced, and the frequency of taking adding more fiber into the food should be encouraged, and hydration should be encouraged.
That's a really great point as well. Thank you so much, Reshma, for that. So I hope that helps you, Neha. We have a question here from Samantha in Sharjah. She says, I get frequent diarrhea and abdominal pain. Is that a sign of something serious? Should I get myself screened?
It depends on the age. Let's say she must be a young lady, she's on the media and things like, so I think my answer by that guess will be no, she does not need any screening. However, there are two sort of loose diarrhea and abdominal cramps. If this is just normal and it comes at any day, even when she's relaxed and she's not rushing and she does not have any stressful time, then of course there might be something underlying. However, if the intestinal hurry or the rush comes when one is rushing or one is under stress, then this could lead, this is probably pointing towards irritable bowel. And for irritable bowel, just to touch on the subject, our bowel is a bit more sensitive than others. For some people, when they get stressed, they start having loose motions or cramps in the abdomen because they get the butterflies like athletes just before their fight or flight situation or competition. They get butterflies in the tummy. So these are the butterflies, sort of irritable bowel symptoms. So one can assess that. And if it is happening like that, then one doesn't need any screening. However, if it happens on a very relaxing day, let's say nowadays, staycations have become so popular, and if you are relaxing by the poolside and things like that, still these symptoms are happening, then probably it'll be best to discuss with your family physician. That's where the family physician role comes in. One doesn't have to come straight to the surgeon or a gastroenterologist. One can see the family physician, a general practitioner, who will look at them and they will be able to guide them in the right direction.
Okay. Praneet in Dubai has a question. I have had persistent issues with hemorrhoids. It aggravates when I have constipation, and it subsides eventually but never goes away completely. Should I get it looked at? Will I need a procedure to correct it?
The answer to that is simple. If you have an ongoing problem, ideally you should get it looked at and get all the right advice as well. As I mentioned before as well, if you took high fiber, took plenty of fluid, and you replace your library in the toilet with an egg timer, this will go a long way. However, when we are having problems, then we not only have to sort out the hemorrhoid, but we have to give it some symptom-free period for a while. So that we get on the top of the spasm of the two muscles, so that both the muscles are relaxed and there's no increased pressure. So with the conservative measures that we have discussed before and taking high fiber, if it doesn't work, then probably it's worth having looked at. Because if hemorrhoidal problem, and especially in ladies who had previous pregnancy and delivered a baby, because they can get increased congestion in the pelvis and larger hemorrhoids, then they can have an ongoing problem. So if it was looked at, most of the time one does not require surgery. But if any treatment was required, that can easily be offered in the clinic. One can walk in and walk out of the clinic and the hemorrhoids are sorted. So I think if it is an ongoing problem and the conservative measures are not working, my answer will be yes, please do get it looked at by one of the surgeons who will deal with this.
All right. The next question we have is again about food. If I don't eat food at the regular time, then I get annoying pain in my tummy. Why is that? Should I get myself checked? And I'll ask you, Dr. Amir, and also Reshma about this one. Dr. Amir, if you'd like to start.
I think you asked this question at the right time, because what happens is that this is the hunger pain that we get. And again, discussing that some people's stomach can be more sensitive than others. And sometimes when we're hungry or we smell food or we get a receptive relaxation in the stomach, and sometimes there can be some acid in the stomach, which is empty. So from that point of view, one shouldn't get it checked. One does not need to bother about this. This is normal, and one should not worry about it. However, if the pain is there at other times, apart from being hungry as well, then of course one should get it checked. But I think on surface, from my point of view, one shouldn't need to get it checked. But I think Reshma will give us good advice how to avoid it.
I absolutely agree with you. I was about to say the same. It could be hunger pangs that might, be resulting in, pain sensation. So yes, having regular meals and, avoiding spacing of meals, long hours, so it's better to have every 3 to 4 hours small and frequent meals rather than to have long hours of fasting in between in order to avoid these hunger pangs.
Just on that, the idea of eating regularly, is intermittent fasting good for gut health and colorectal health, or is that not so good?
I'm not a fan of intermittent fasting because, usually patients who would like to come for a weight loss, they would ask me this question if I can go with intermittent fasting. And I recommend them that it's not the hours of eating matter. It's also the food that you're eating during those hours matter. So, for example, if you're having high calorie, refined foods, or if you're having alcohol, or if you're having, red meat or processed foods. I mean, of course, if you are, even if you do intermittent fasting, it wouldn't help anyway. So it's not just the timing that affects, it's also the kind of food that you select is affecting your gut health.
Yeah, the quality of the food is very important.
Quality of the diet, yes, exactly.
Dr. Amir?
Yeah, I think with my deep interest in bariatric surgery and having discussed this over the years, what goes through our mouth determines how healthy we are going to be and what weight we are going to be. And on a lone island, you're not going to see anyone who is overweight. If we had to walk, fish ourselves, then find the fire and cook it, we won't be overweight. Now, the thing about weight loss is most of the time people are doing all the right things. And nowadays with Dr. Google and all the modern things, and we have your media advising us and helping us with these sort of webinars and other things, we all know what healthy diet is. But in my experience, what I've noted, that the sticking points which come to losing weight in the patients who might have had weight loss surgery, or even before that, if you're recommending it, the sticking points are taking the energy drinks or taking the drinks which they believe are zero drinks, which they are not, because they do interfere with your metabolism and you don't lose weight. Using the diluted drinks, thinking that those are fine for you, taking too much of fruit or nuts as well, going in one direction or another. And I think one should have a very sensible diet, monitor the calories, and then follow that. And that does make a difference. And one of the things which I always tell my patients, especially the mothers, because mothers have to feed everyone, then have to wait on everyone, and then have to clear all the things as well. So they won't eat much themselves, but while cooking, they taste it, And then when the children leave their food in the plates, they just clear it because it's very good religiously and socially and in every respect. So this does add up. The other thing which I advise to my patients is that they should not buy anything that they're not going to eat themselves. Lots of time we go to the supermarket when we are hungry. So we should always go to the supermarket when we have had our meal, so that we go over there after that. We will not buy any unhealthy food. We will not buy carbs. We will not buy the sweets and all those things. And if we don't eat crisps, if we don't eat biscuits, if we don't take snacks, if we don't take fizzy drinks, these are the four biggest culprits. Then we shouldn't buy it for anyone else. Our guests should have healthy things as well. And I think once we follow it, we are fine with that.
Just taking all the fun out of it, Dr. Amir.
I apologize because
it's true, really. And I think, once your body gets used to having, those healthy foods and you really feel the taste of it, the taste of good food and you enjoy that and it becomes a habit, it becomes something that, when you do have the sugar and you do have the fried foods and that kind of stuff, you feel sick, you start to feel sick. So it's what we're used to. Honestly, it is truly what we're used to as someone, who's gone through that journey as well.
If I may add one thing to that.
Yes.
That we should drink our solid food and we should eat our fluid drinks.
Yeah.
Because nowadays I can finish a burger in 15 seconds. And I believe that in another 50 years' time, the human race won't have any teeth because we don't use it, we gulp it. Because we are busy, we are rushing from one place to another. So if we eat slowly, the time for eating is only 20 minutes. After that, we feel full. So in that 20 minutes, we can eat a very large portion or a small portion. So we should chew it very well, eat it slowly. And when we are drinking, we should cherish that as well. Even water is a lovely drink. And after intermittent fasting or fasting, when we get a glass of water, we think we are in heaven. So I think even when we are drinking it, we should drink it we should chew it. So we should chew the liquids and we should drink the solids. And then it works beautifully.
That is a really great tip, Reshma. Yeah.
I think the smoothie culture should be forbidden, should be banned.
It's a really good point.
See a lot of
elaborate on that. Yeah.
Yeah, I see a lot of patients who would say, I'm actually juicing something, or I do smoothie at the breakfast. I mean, I don't see, if you are physiologically healthy, you have teeth, you can chew well. I would encourage them to go with the solids, and then it helps you burn calories as well when you're using your muscles. You're using your jaw muscles, you're using your gut muscles to break down the food. So it's a form of like burning calories. So I wouldn't recommend going with smoothies and juices and so on, liquid drinks.
As we come to the end of what has been an incredibly informative webinar, I'm just going to throw a final question at you, Dr. Amir, if I may, about exercise and how much exercise helps colorectal health. How important is it?
That's very important. And I think exercise is considered as a factor, maybe for many reasons, because the way the exercise affects us or our body, it's not only for colorectal cancer, but for various other things as well. But here, just talking specifically about colorectal cancer, doing exercise and walk helps us to adjust our dietary intake. It helps us to relax our muscles, our body, our gut as well, allows the food to go through properly. It helps with the wind problems and the other issues that we have. It also helps us to regularize our bowel movement so that with the exercise, as we are relaxed, we are walking around, we have a proper bowel movements at the end of that. The other benefit of this is that with exercise, our general fitness is better. We have less stress. And as we know, that people who are healthy, who have less stress, are less likely to have the problems like cancer, heart disease, and various psychological and psychiatric issues. And at the same time, of course, with walk, exercise, as we are going to maintain our weight, we are going to eat healthy as well as a result. We are more likely to drink more water. We are more likely to drink healthy food. We are more likely to take vegetables and other things. And we are unlikely to put on extra weight. So this way, overall, I think if there was one message to take away from here, that will be do regular exercise for your general well-being and for your gut as well.
Absolutely. I know my husband suffered through hemorrhoids and the doctor said to him, look, it's because you're sitting down too much. you're not getting up to move. And he loves to read. A lot of us love to watch TV, whatever, but just you need to regularly get up and move. Movement is vital, and I think very much supports and speaks to your point, Dr. Amir. Super informative, amazing. We've had messages come in. Muhammad Mujadba has texted in, very informative. Thank you, Gulf News. Just wanted to add one thing. Fasting prevents all types of cancer, at least fasting 1 to 2 days per week. Not sure that it prevents all types of cancers, but definitely it helps, as well as the doctor and the dietitian concurred. So as we finish up the webinar, don't forget that, of course, all of this great information, it doesn't replace a comprehensive consultation with your healthcare professional. And of course, you can consult with the doctors at Faqih University Hospital. You can consult with Reshma and the other healthcare professionals there as well. And the details for the hospital are available by clicking on the links on the website that we are on right now. And of course, that brings us to the end. But I just want to thank you both so much, Dr. Amir Nisar and Reshma Devjani. Thank you all for just some amazing information that we've all learned so much from. Thank you.
Thank you.
Thank you very much.
Thank you, Sally. Thank you.
And of course, a big thank you to you, our audience, for joining the discussion today. And the session is going to be available online on the Gulf News and AG NC3 YouTube channels. So don't forget, if you haven't subscribed yet, do it right now. And you can also share the session with your friends and family as well. I know everybody's going to benefit from this one. My name is Sally Musa for Gulf News. Thank you so much, and bye for now.